And you know, a trip to the dentist involves a whole lot more than just fighting cavities. In fact, it could actually save your life. Dr. Bhandari is here to educate us about oral cancers and other things that your dentist can do for you. How are you, Vineet? I should say doctor.
Oh, no,
thanks.
Vinny's fine.
Vinny, thank you. Thanks for coming in, Vinny. Well, let's talk about oral cancer because it's a cancer that not many of us think of right off the bat when we think of the awful disease. But let's talk about some of the stats about someone contracting oral cancer.
Yeah, roughly about 3,100 people in Canada will develop oral cancer, and in the States it's about 10 times that. It's mainly a disease of the 40-plus age group, and men are at a greater risk than women.
Now, what determines exactly a prognosis of oral cancer for you as a dentist looking at it?
If someone has oral cancer, it's really the size of the lesion. If the lesion is less than 4 centimeters and doesn't involve the lymph nodes, the prognosis is very good. There's a good 80% recovery. But if it involves the lymph node or the lesions are large, the prognosis drops down to about 30%. So the size is very important.
Now, is there two types of oral and skin cancer we want to talk about?
Well, no. 90% of oral cancers are squamous cell carcinoma, and 90% of all skin cancers are basal cell carcinomas. And squamous cell carcinomas are found mainly on the tongue, but can also be found on the cheek, the buccal vestibule, which is the side of the teeth area, and the roof of the mouth. And skin cancer is mostly found on the face, but in particular the nose and the lower lip.
But even when you have a patient coming in, even though you're a dentist and most people think you're just dealing with teeth, if you recognize something else in the lips, let's say around the nose or around the cheek, you could recognize that as well.
Definitely. I don't just look at the mouth. That's being tunnel visioned. I always check the head and neck, behind the ears. And then, of course, you look and feel inside and have a visual check as well, definitely.
Well, let's talk about some of the causes.
The causes are really multifactorial in nature, but some of the main causes are tobacco. And by tobacco, I mean, of course, smoking and chewing tobacco, chewing as in baseball players, chewing tobacco or betel nut. Excessive alcohol has been implicated in oral cancer. And one's really that's becoming very prevalent is the human papillomavirus that causes oral cancer, and it also causes cervical cancer. And of course, the last thing is the sun. The lower lip is affected, and people tend to get cancer on the lower lip.
And so even a lot of people don't even put sunscreen, they're putting it on their face, they're not putting it on their lower lip.
Absolutely. They don't put it on their lips, they don't put it on their ears. And you can't get skin cancer on the ear.
We are running out of time, but a number of things you also do is cosmetic dental work as well. And you're unique in yourself. You're unique because a lot of dentists they're not certified like yourself.
Well, it's not that I'm certified in that self. I've taken a lot of courses at university settings, and I try and do the best I can, sure.
Excellent. Well, we appreciate you coming in. You can find out more information from Vinny or Dr. Vineet Bhandari at his website, bhandaridental.com. And obviously, going and getting checkups frequently is the most important thing.
Prevention, definitely, rather than treatment.
Well, we're coming up on 8 o'clock on this beautiful Wednesday morning. Come on back. Lots more Morning Live coming up after this.
And laugh out loud as I'm beaming